Good morning, everyone. It's 9:30. Thanks for joining us for today's briefing a little bit early. On the panel this morning, we have Milwaukee County Executive David Crowley, Milwaukee Mayor Tom Barrett, Dr. Ben Weston, Associate Professor at the Medical College of Wisconsin and Director of Medical Services for the Milwaukee County Office of Emergency Management, and Marlena Jackson, Interim Commissioner of the Milwaukee Health Department. We do want to note there will be a separate news conference later this morning regarding the Milwaukee Bucks plan to welcome back fans, so we'll defer questions about the Bucks until later. We also have a hard stop at 10 a.m. today, but we'll get to as many questions as possible. County Executive Crowley, we'll start with you.
Well, thank you so much, Sydney. And as you said, today is a busy day. We have the spring primary elections today, so the polls will be open until 8 p.m. You can visit myvote.wi.gov for details about the ballot for your municipality. And if you're going to be voting in person, please remember to practice the 3 W's, which is wear a mask, wash your hands, and make sure to watch your distance. But also later today, Governor Evers will be delivering his state budget address. And I want to thank Governor Evers for including a half-cent local option sales tax in his proposed budget. Should this proposal make it through the legislature, our local voters would need to decide via referendum on whether to increase our local sales tax. And Milwaukee County needs to use every tool in its toolbox to invest in our communities, our residents, and our businesses to ensure that this region, as well as our state, continues to grow and that we can fight this pandemic. And the ability to invest in Milwaukee County will help us achieve our vision of achieving racial equity and help make Milwaukee the healthiest county in Wisconsin. And we appreciate the state's support thus far, but we also hope that the governor allocates more funding to Milwaukee County, given that we're the largest county in the state and our residents have been disproportionately impacted by the challenges of COVID-19. And this evening, we're welcoming President Biden on his very first presidential trip right here to Milwaukee as he holds a town hall to answer questions about the pandemic and our nation's economic challenges. And with the president's visit to our community, I would be remiss if we did not share that our greatest need is for more vaccines. Right now, vaccination rates aren't congruent with the communities facing the most extreme impacts of this disease. And we know that one of the issues in our way is supply. So an increase in the number of vaccines allocated not only to Wisconsin, but Milwaukee County as well will go a long way to increasing equitable distribution. Because there is an intersection between COVID-19 and structural racism. The data shows that the impact of COVID-19 has not been universal. And we spend a lot of time talking about these disparities, as we should, but I want to make sure that we also talk about the root causes to these disparities. And the root cause is that our system is broken. And while unemployment skyrocketed across the spectrum, unemployment for Black workers is higher than our white counterparts. And for those still going to work, Black workers are more likely to be in frontline jobs categorized as essential, forcing them to not only risk their own health, but their family's health as well, just to pay rent and put food on their table. And so the dramatic disparities highlighted by the pandemic show deep inequities and have existed in government systems for generations. I mean, we know that before this pandemic, Black residents historically suffered from higher unemployment rates, lower wages, lower incomes, and fewer savings than white counterparts. And the current economic damage has been magnified due to the prior insecurities. But we also know that Black workers face greater underlying pre-pandemic health insecurities that make them more susceptible to contracting the virus. And these are pre-existing health conditions such as hypertension, asthma, and diabetes. These are all illnesses experienced at a higher rate for Black than whites, and are also associated with greater risk of death from the coronavirus. And Black workers are also more likely to be uninsured than white workers. The lack of health insurance results in less early diagnosis and treatment, which are essential to minimizing the severity of chronic illnesses. And these disparities not only exist across those with historic lineage to slavery, but in other communities of color as well. We cannot forget the impact on our Latinx communities, First Nations, and Southeastern Asian brothers and sisters who call Milwaukee County home. These disparities aren't inevitable. They exist because of structural racism. So let's be clear. When discriminatory practices in one sector of our society support corresponding practices in another sector, they create an interconnected structure of inequities in laws and practices. And this is what structural racism is. The consequences are aspects of nearly every system of our society mutually supporting practices that encourage discrimination and an unequal distribution of resources. And we're seeing these two destructive forces, COVID-19 and structural racism, play out every day during this pandemic. And so we must do more locally and nationally to address these inequalities that have exacerbated the COVID-19, but we know that these go so much deeper. And we need to change the way that we spend our money so we can invest in equity. And we need to make sure that Black, Indigenous, and other people of color also are represented at decision-making tables. And we need to use this pandemic as an opportunity to look at the root causes of racial disparities that we're seeing and make sure that we fix the system and not the symptoms. And with that, I would like to hand it over to Mayor Barrett. And Mayor Barrett, it's yours.
Thank you very much, Mr. County Executive. I want to begin by sharing how excited we are to have President Biden visit us today. As the County Executive noted, this is his first official trip basically outside the Washington, D.C. area. And we're very proud that he's chosen Milwaukee and he's chosen Wisconsin for his first trip on Air Force One. So we're very, very excited. We've specially ordered some more Wisconsin weather for his visit, so he'll understand what Wisconsin weather is like in February. And as I look out the window here at City Hall, we've got a lot of people out there working right now just to get things prepared for this town hall meeting tonight, which will be right across from City Hall at the Pabst. I want you to know that the audience size for the town hall is much smaller than our current rules, health and safety rules allow, and the Pabst Theater has been working with our health department on a formal safety plan. That obviously is at the forefront to make sure the president and everyone who attends the town hall meeting tonight will be safe. So all the social distancing and other safety measures will be in place. We also know that this weather has wreaked havoc on a lot of what we're trying to do as a community as it pertains to testing. The extreme winter weather yesterday affected our testing operations. All three locations, in fact, all three community testing sites were closed. However, the sites will reopen today. And again, I want to stress how important it is for everyone with symptoms or anyone who has been in close contact with someone who has COVID-19 to get tested. I think we all recognize that here we are now in the latter half of February. So we're coming upon the year mark of COVID-19 in our community. And we're definitely starting to see indications of COVID precaution fatigue. And that's not good because we know that there could be another spike. And in fact, the fatigue is resulting in more violations to our health department safety orders. In this past weekend alone, there were more than 30 violations that will lead to citations. So we are not taking our foot off the gas as it pertains to enforcement for citation violations. And Interim Commissioner Jackson will expand on this fatigue later on in this briefing and talk about other important news that's affecting our community right now. I also want to share that we continue to push for more vaccine. The county executive did a really, really good job of talking about the systemic racism and the factors that result in the challenges that we face here in Milwaukee. Each year there's a study that comes out or a test that comes out that looks at the health of all 72 counties in Wisconsin. And traditionally, Milwaukee ranks either 70th or 71st, usually 71st among the 72 counties with health. When we saw the numbers last week that in terms of the number of vaccinations per capita that we were receiving, we ranked 64th. So I had a very, very good working session with the Department of Health and Human Services on Saturday with the governor's staff. And we're confident we're going to be able to work with the state to make sure that there is an equitable distribution that includes race. The racial equity data continues to be alarming, and we want to see a more equitable distribution among our residents. A portion of this will, of course, result in our having more mobile units, and that's something the health department is working on right now. So we are ready to provide more vaccinations at the Wisconsin Center, and we're planning for more outreach efforts in our communities, but that requires we receive sufficient vaccines. So we're all working together. We're working well with the state. They understand we need more, and I think they're willing to work with us. The key, of course, is to get more from the federal government as well, and that will certainly be an issue that comes up with President Biden today. So a lot of work is being done, and we appreciate everybody's understanding. We're going to get through this together. And with that, I'll turn it over to Dr. Weston.
Thank you, Mr. Mayor. Good morning. First to our numbers, we have had 96,724 confirmed cases of COVID-19 in our community and 1,045 individuals who have died in Milwaukee County. We continue to see promising downward trends in cases, hospitalizations, and deaths thanks to the work of individuals continuing to mask, to distance, and to get vaccinated. We've heard quite a bit about these different variants, but there's been relatively little experience with them in the United States to understand the implications they may have for our country broadly, and more specifically, our state and our county. The most widely studied variant, and the one that is currently most widely distributed in the United States, including several cases in Wisconsin, is the UK variant, or B.1.1.7. While it's just getting started in the United States, there's much more experience with this specific variant in much of Europe. One of the items that is carefully tracked is what portion of the virus is detected that is the variant. So for example, when the variant is just getting started, like here in the United States and in Wisconsin, you may find it in 1% or 2% of samples tested. As time goes on, the variant, due to its increased transmissibility, may increase to 20% of samples, and then 40 and 60 and so on, to become the dominant strain at near 100% of samples. This is what we've seen in the UK and what we're witnessing in much of Europe now. And the reason it does this is simply natural selection of the virus, or survival of the fittest. There's a mutation in the virus and it made it more easy to transmit person to person. So over time, that strain becomes more prevalent in the community. Even as we see trends overall decrease and improve in our community, in the background of those numbers, the B.1.1.7 strain is increasing, and at a dramatic pace. In the United States, it's been shown that the UK strain, or that B.1.1.7, is doubling the number of people infected about every 10 days. So that's not too big a deal when it starts off, one person, then two people, then four, then eight. But when they quickly ramp up, we get to 1,000, and then 2,000, and 4,000, 8,000, and so on. And that has a major impact. And what we're seeing in the European countries is that once the strains begin to spread more widely, they take about 1 month to become an overwhelmingly dominant strain. And being more transmissible, that means more cases. And being more severe, that means more hospitalizations and more deaths. There's little doubt that this is the direction we're heading. However, we can blunt this coming spike. It can certainly be softened through vaccination efforts, and it can be blunted through personal precautions. So it's tempting to see our promising trends and our promising numbers and think that this is the time to ease up, to pull back on restrictions, to ease back on orders as a community and pull back on precautions as individuals. To be clear, that time will come. And I can't wait to get back to our more normal way of life, but we're not there yet. We have to wait on two key items. First, how do these new dangerous strains affect our trends and our community health? And second, how effective is the vaccine in preventing transmission of disease? Data is starting to come in, and we would expect to know more on both of these fronts in the next 1 to 2 months at least. In the meantime, continue to be vigilant, continue the precautions, and get vaccinated as soon as you are able, and hope for a better summer to come. Thank you and stay safe, and I'll hand it to Commissioner Jackson.
Thank you, Dr. Weston. I hope I am I clear? I have to wear my mask. I'm at the Wisconsin Center today. Thank you, Sydney. So first I want to start with just sharing our general vaccination plans for the week as it relates to the Wisconsin Center and the Milwaukee Health Department. So we plan to vaccinate this week almost a little over 5,000 individuals, 5,058 with first and second doses of Moderna and still Pfizer vaccine. Next week, we also plan to vaccinate a little over 5,000 individuals. Please know that right now, our current schedules are able to be opened up for 2 weeks based on our new ordering system from the state. So the state has now allowed local municipalities to order allocations for vaccines for 2 weeks instead of 1. And that's really great because it allows us to do more long-term planning as it relates to getting individuals vaccinated, as well as looking at our overall mobile plan. So please know that right now you can go to the milwaukee.gov/COVID-vax and get scheduled for your appointments. You can self-schedule. We have appointments open for this week and for next week. So know that that is available to you. Additionally, we are continuing to take calls for individuals who don't have access to internet. 414-286-6800 is that phone number where, again, individuals can call and they can get directly scheduled into our system for vaccinations. Just as a reminder, we are scheduling individuals who are 65 plus, as well as individuals in our 1A category, which are healthcare workers, police, and fire. So please know again that you can go there and get scheduled. We have open slots and open appointments, so we're wanting to get those filled as soon as possible. In addition, wanted to just continue to share, as Dr. Weston had just shared, some information as it relates to our positive cases. So while in the city of Milwaukee, we continue to see positive trends, I completely 100% agree with Dr. Weston that we have to continue to be very mindful and very aware of our new variants that are out there, and know that for Milwaukee, we did receive information that the UK variant, the B117, has, we found our first one in the city of Milwaukee it was reported on January 28th. So we anticipated, obviously, as Dr. Weston shared, as it relates to the spread, that it would reach southeastern Wisconsin. It has reached Milwaukee, and so we are just being really mindful of that. In addition, we also, as our enforcement efforts have picked up, we did over the weekend issue over 32 citations, which is twice the number that we have issued in the past. So we know and understand that individuals now are tending to let up on their regular mitigation efforts, meaning the social distancing, your mask wearing, and your washing your hands. Understand that those mitigation steps are necessary for us to continue to have low trend numbers, but it's also necessary for us to keep our orders where they are. If we notice, or if we see that individual companies or individual establishments cannot abide by their safety plans, it makes it very difficult for the City of Milwaukee Health Department to put orders in place that allow for additional capacities and additional or less mitigation when we know that there is new COVID strains, when we know that current establishments cannot currently meet the needs of their safety plans. So again, this is not the time to let up on washing your hands. It's not the time to let up on watching your distance or wear a mask. These things are just as important today as they were 6 months ago and as they were 8 months ago. So we have to continue to stay diligent. And with that, I'll turn it back over to Sydney.
Thanks, Commissioner Jackson. We do have a few questions in chat already. The first comes from Nick Boer at WISN 12 for Mayor Barrett. The governor said last week on Upfront that if Milwaukee needs more vaccine, they need to ask for more. How much are we ordering this week? How much are we getting? Will you be increasing the order amounts given what the governor said?
Well, I've had good conversations with the governor's office as recently as this morning, and we're working very, very closely with them. I think there was some confusion because we had not received the number we had requested last week. We received less than the number we requested. I think that they're referring to the mobile sites, and so we are working with them to get more for our mobile sites. Some of this involves, of course, the FEMA site that has yet to be finalized, and whether we're going to get more doses for that. The commissioner can tell you specifically how many vaccines we've requested, but I think it's accurate to say that last week and in a number of the weeks prior to last week, we put in a number and we received a number lower than that from the state of Wisconsin. And I understand the state has some issues. This is one of the issues that I talked about on Saturday when I was talking to the governor, his staff, as well as the head of the Department of Health and Human Services. And it's my understanding that several weeks ago, the state was receiving about 70,000 doses per week. Last week, I think it was up to 90,000. And I believe it's going to go up an additional 6,000 or 7,000 this week. So we're seeing a larger number of vaccines coming, but we are doing everything we can to maximize the number here in the city of Milwaukee. So Commissioner, you might have at your fingertips there the exact number. It gets a little confusing because some are going to go for the first vaccine, some are going to go for the second vaccine. But Commissioner, do you want to share with them the numbers if you have them there at your fingertips?
Yeah, so for our first vaccinations this week, we ordered 4,000 vaccines doses, and we did receive 2,000 for this particular week. In addition, again, because we order at 2-week increments now, so our next order, which will go in today actually, is for the week of the 1st, March 1st and March 8th. And for both of those weeks, we are ordering a total of 7,500 new doses. So each week, 7,500. It's important to note again that March 1st opens up a new group of 1B eligible participants. And so in anticipation of that, we are ordering a large number of vaccines, understanding that we'll be looking to vaccinate our teachers as well as our daycare.
Thank you. Another question from Nick Bohr for Mayor Barrett and County Executive Crowley. Specifically, how do you reach out to minorities? How do you know it's working? Why doesn't the city screen for race on the vaccine signups?
Well, I can share with you one of the challenges we've seen, and this is not a state, a city, a county issue, but to let you know anecdotally how challenging this is. Many people have probably seen that Walgreens has now become a partner. And I got a text message from some friends of mine the other evening that had received their vaccine at Walgreens at the one in the central city on Capitol Drive. They're an African-American couple. And they said that they were the only African-Americans in the Walgreens receiving the vaccine. And I think it was their conclusion, and I agree with them, was it's a reflection that system was built apparently on internet access. And so that certainly is one of the issues. So you'll note that when Commissioner Jackson talked about our sites and the openings, she specifically made a point to say that you can do it online, but you can also do it through a phone call. And the reason we've done that is because we know that there are a lot of older people, a lot of people who do not have internet access, and we want to make sure that everyone has that access. In addition to that, and I'll allow the commissioner to talk about it after the county executive talks about it, is we're working to get more sites in the community. So I'll turn it over to the county executive for what he wants to add, and then maybe the commissioner can weigh in as well. Mr. County Executive. You're on mute, David.
Thank you so much for that, Mayor. So I agree with the mayor, but this is also about partnerships. We know that we have to make sure that we're working with many nonprofits throughout the community to make sure that there are other trusted voices to talk about the efficacy of this vaccine. But I will say that we will be sharing some more details on Thursday about how we're getting to some of our seniors and some of our users that uses our health and human services, making sure that they have access to the vaccine. But we need to make sure that the health is not just about vaccines, and that we do not have a health department here in Milwaukee County, but we're going to continue to work with our local partners and making sure that we get this vaccine into the arms of the most vulnerable residents here throughout Milwaukee County.
And I would just add that here at the health department for the city of Milwaukee, we have always had very good working relationships with all of our different underserved and communities here in Milwaukee. So whether that's African-American, Latinx, as well as our Hmong population, as well as our refugee and immigrant population. So we're really taking our opportunity to leverage those relationships to get to, again, the sites and the spaces where we know that those individuals in those communities tend to either congregate and or work to make sure that we are addressing that particular issue. And it has been a really good reception as we have reached out and as people have reached out to us.
Our next question comes from Allison Durr at the Milwaukee Journal-Sentinel for County Executive Crowley and Mayor Barrett. President Biden is expected to speak tonight about his coronavirus proposals. What do you want to hear from him, and what do you think those will mean for Milwaukee and Wisconsin?
Well, I mean, I think at the end of the day, the mayor may agree with this and may have a little bit more to add, but we need more vaccines. We can't continue to add more people to the list, tell people to get vaccinated when we don't have enough doses. And so I want to hear more about that, but also the recovery plan. We know that this has had an economic toll on everybody across the nation. So want to know what is the next steps to make sure that we bounce back better.
And I couldn't agree more with the county executive. I want to hear about vaccines, vaccines, vaccines. That's what's number one on our mind. In addition to that, again, as the county executive said, this recovery plan, I'm very thankful to the president for including relief for cities and counties and states in this relief plan. That's something that's very important to us. So I want to hear more about that. Another thing, and I don't know if he'll touch on this because I think it's going to be pretty much a COVID trip, but I was very, very impressed over the weekend where he said he wants to see some sensible gun laws. Last year in Milwaukee, we had the highest number of homicides on history. A large number of them involved young men who should never have been able to have access to guns. And so I'm very, very eager to work with the president to have some sensible laws in that area as well.
The next question comes from Shemaine Mills at WWM. Later this week, the Centers for Disease Control comes out with a report on national life expectancy rates. Dr. Weston, County Executive Crowley, or Mayor Barrett, can you speak to the challenges that may affect life expectancy in this area?
Well, very briefly, I think one of the things we've seen in the last couple of years is unbelievably the life expectancy in America going down. And I think a large portion of that was because of the other pandemic we're facing right now, which is the opioid heroin pandemic, because we're seeing record numbers in that area as well. So I don't think I ever expected in my lifetime to see our life expectancy go down. But now with the combination of COVID, of the opioids, now the other challenges we're seeing with homicides here in major American cities, rising traffic deaths, it's a stressful time right now. And I think we all recognize that.
I couldn't agree more. I mean, when you think about Milwaukee County, we are at the penultimate of the healthiest county list. We are 71 out of 72 healthiest counties in the state of Wisconsin. And we really have to make sure that we understand the connection to the social determinants of health, whether we're talking about housing, access to healthcare, access to employment, to education, but your community overall. And we know that here in Milwaukee County, we've seen a gap in life expectancy between white and Black people. If I'm not mistaken, and Dr. Weston, feel free to correct me on this, is that white people live about 14 years on average longer than Black people here in Milwaukee County. And so this lets us know that we have a long route ahead of us, but this is one of the reasons why Milwaukee County has a vision and mission of being the healthiest county in the state by achieving racial equity.
Yeah, that's exactly right. And some of we'll see what the CDC comes out with, but some of the earlier reports have shown that, not surprisingly, unfortunately, there are disparities in the change in life expectancy that COVID is bringing forth in our country. One of the earlier studies about a month ago showed that I think it was white Americans are going to lose about a year, African Americans 2 years, and Hispanics 3 years. And so we've certainly seen the racial and ethnic inequities with COVID, and this certainly is one of the most disturbing of them. As the county executive mentioned, we aim to become the healthiest county in the state, and life expectancy is a key metric in those county rankings and evaluations. And it's a key metric that we as a county want to continue to evaluate, in addition to the many other physical and health and social determinants of health, with a specific lens on health equity. So that applies to the COVID response, but it extends much further than that, and certainly will continue well beyond the end of the pandemic.
We are just about out of time, but I do want to try to get to these questions about the citations from the Health Department for Commissioner Jackson. Question from Allison Durr. Were the additional 32 citations issued by Health Department personnel or private company? And were the citations for mask or capacity violations or something else?
Yeah, so the 32 violations were issued by Milwaukee Health Department staff that have resumed earlier this year, going out to do those site visits. Additionally, we do know that the majority of the citations were for masks and social distancing, not capacity.
So I think you covered a couple of the questions from Sari Lesk at the Business Journal, but besides the citation, do businesses violating their safety plan face any penalties, such as revocation of their safety plan?
They can. So first and foremost, they can lose their ability to have capacity limits over the 25% if they are not in compliance with their safety plan and with the current order. Secondly, they can also lose their license through the license revocation process.
And our final question is from Me, Wisconsin. What is the plan to help the Latino Hispanic community to promote the vaccine in this population, the most affected and the largest minority in Wisconsin?
I think one of the most encouraging things we saw was the decision by the state to provide a larger supply for our federally qualified health centers, the community health centers. And on the south side, the 16th Street Health Center is a longtime superstar in connecting with people in the Hispanic community. So I think right there, that was a major, major step forward, and the federal government has recognized the importance of the community health centers by providing them with a greater supply. So to me, that's a major first step. And again, we're going to continue to work with the community health centers as well as churches and other community groups for outreach in the Hispanic community, just as we are in the African American community.
All right, we do have to wrap it up due to some time constraints. So thank you everyone for joining us today. Thank you to our panelists, and we will see everyone back here on Thursday. Have a good day, everyone.
Thanks, everyone. Make sure to vote.
Thank you.